In December 2023, President Bola Tinubu declared that health is back on the front burner for Nigeria. This announcement came against the backdrop of the departure of pharmaceutical companies such as GlaxoSmithKline from Nigeria, leading to the increase in the price of medication and pharmaceutical products, compounded with increase in double-digit inflation rates and a drastic depreciation of the value of the naira, amongst other economic factors. Basic healthcare has become increasingly unattainable for the average Nigerian.
Well, the Minister for State for Health and Social Welfare, Dr. Tunji Alausa, shares his insights on the federal government's plans to rescue the health sector and deliver healthcare to Nigerians in this Arise exclusive interview with Vimbai Mutiniri Ekpenyong.
Good afternoon. Such a pleasure to have you on the program today.
Good afternoon, Vimbai.
Let's get straight into it. Now, in December, of course, we know that the president made a bold declaration that health has now come back to the front burner. And, of course, that was at the ambitious rollout of the Healthcare Renewal Investment Initiative. A few months down the line, tell me, how is that going?
Obviously, in December, the president, I think it was on December 12th, that the president launched, President Bola Ahmed Tinubu launched the Health Sector Renewal Investment Initiative, and he made that bold statement. But before that, even during the campaign, when the president was campaigning, he campaigned heavily on providing meaningful, decent health care to every citizen of Nigeria. And he's followed those campaign promises with actions and words. I followed those campaign promises with actions. And that's why he personally led that launch of a Nigeria Health Sector Renewal Investment Initiative, which is, I'll explain more to you about that. A big part of that is that the way we collaborate with our development partners, now we're now coordinating more with them, reducing the fragmentation in where things were done. As you can see, a lot of money has been spent on the healthcare sector, but the kind of results we're getting, those results are not matching the amount of money being spent. So we looked at it and said, okay, there's a problem here. And that problem is that there's a lot of fragmentation. People are spending the same, multiple people are doing the same thing. So we said, okay, we have a basic healthcare provision fund, which is 1% of the consolidated revenue. As to the gateway, one to the primary care gateway, the National Health Insurance Gateway, and the Emergency Services Gateway. It's not a lot of money, 1%, but that doesn't meet the needs of a large population. But then our development partners are spending more money in doing a lot of things. So we said, let's kind of coordinate more so that not necessarily mingling the funds, but let's coordinate in a more parallel manner, where we can begin to pull more funds into our primary care setting, into our national health insurance, so that we can have more funds to deliver high-quality services to Nigerians. That's what we call our sector-wide approach programming. Beyond that, as part of the Health Sector Renewal Investment Initiative, we're now going to unlock the value chain in our healthcare sector, moving our healthcare sector from just a consuming part of the economy, but as a more towards growth-driven part of the economy. Currently, our GDP, health as a contributor to our GDP is less than 6%. We can move this year over year to about 15%. We would have been able to succeed in creating a large number of good, durable, decent, high-paying jobs to our teeming young population and Nigerian population that need this job. We will be setting medical industrialization up in each of the 6 geopolitical zones of the country, and we need to mobilize more funds into our country to set up new pharmaceutical industries, medical device industry, medical consumable industry. And the president has also appointed a national coordinator to lead this presidential initiative on unlocking the value chain in the healthcare sector.
You've raised so many points there, so many things to unpack. I was going to leave money matters until a little bit later on, but since, we're talking budgets and money matters, it's been 23 years, approximately 23 years since Nigeria signed up to the African Union's Abuja Declaration. That means 15%, of course, the Abuja Declaration is about ensuring that at least 15% of the budget goes to healthcare. Now, we still haven't met that. We're still well below 5%. And, people are wondering, what is it? What is stopping us from making the necessary commitment from our fiscal to the much-needed development, like you're highlighting, much-needed development that needs to take place? Unfortunately, critics would say, well, it's because our decision-makers don't need Nigerian healthcare, they travel. So why are we not able to allocate the necessary budget towards healthcare? Yeah,
you're right. Beyond not being able to allocate the necessary care budget, that might necessary budget to healthcare sector, that might be a thing. That's actually a thing of the past now. We know the Abuja Declaration, 15% of the budget should go to health. But look at what's happening in this 2024 budget. This budget has the highest allocation that we've ever seen in the last decade. We have more money budgeted, allocated for infrastructure improvement in our healthcare sector, equipping our hospital with more state-of-the-art equipment, building new cancer centers across our country, even building new hospitals. And this has only been made possible by the president because of his commitment, President Bola Ahmed Tinubu's commitment to the healthcare sector. So we have more money in the last decade ever in the budget, in this 2024 budget. Now, is it up to the 15%? No, but actually more than 5%. But if you look, where we are today, we've started very well. Obviously, year over year, there will be more budgetary allocation to health. But I can promise you when we're going to get to that 15%, but we've started very, very well with significant increase in the amount of money that is budgeted for it in this 2024.
Okay, great. Now, of course, the third biggest line item on that budget is going towards cancer and the infrastructure around cancer. You've already alluded to the 6 centers that are being, shall I say, inaugurated to be implemented during this, throughout this year. So, we've just commemorated World Cancer Day and these initiatives. So can you share a little bit more about the work and the emphasis that's being done with regards to cancer?
Okay, this week, I think February 5th, Monday, was the World Cancer Day. Cancer, it's not a Nigerian problem. It's a world problem. But then, what are we doing in Nigeria? With cancer care, we have to talk about prevention. We're also investing. The government is taking this a proactive step to prevent cancer. And that's what we've done. In October of last year, we rolled out and immunized 7.7 million young adolescent girls with the human papilloma virus vaccine. That's the biggest number of people that were ever immunized in the entire Africa. We did it within a short period of time. And we will continue to increase, make those vaccines available. That is a big push to prevent cancer, because the HPV vaccine has about over 70-something% protection from preventing women from developing cancer. Of course, we're doing a lot of other education, getting people, telling them the importance of mammogram and the importance of lifestyle modification so that they can reduce their risk of having cancer into the future. Prevention is a big part, and this government is heavily focused on doing that. Now, let's now talk about cancer care itself. The government is very committed to making these services, cancer care service, available to the population. That's why, beyond the previous cancer care centers that have been built by the federal government, we're going to be building another 6 centers in each of the 6 geopolitical zones in the country. And the groundbreaking of those centers will be happening in the next few months. As well, we also have some significant amount of money in the budget to improve our other federal tertiary hospitals to facilities and purchase equipment for them. And as we do that, we also have the Cancer Fund, currently domiciled at the Federal Ministry of Health, which eventually will be moved to our National Institute of Cancer Research and Treatment, the NICRA. That's a new institute that was just set up. That institute will focus on cancer research and treatment. We're expanding capacity at that institute. We're building technology platform to be able to provide platform to support indigent, vulnerable Nigerians with cancer into the future. Funds will be dedicated, special cancer fund will be dedicated for Nigerians where they can access and their care will be paid for into the future. This government is a government that really wants Nigeria to have a very good healthcare system.
Now let's talk about it from a policy perspective, because of course we have seen more than ever, I have to give credit for that, a lot of commitment to the National Health Insurance Act. However, people are saying with regards to cancer, it's not holistic enough. What are some of the amendments that need to be made there?
The amount of money in our National Health Insurance system is still not enough. That's why we've just appointed a new Director General for that. We're going to work with what we have now, but into the future, we have to make we're looking at what structural changes we need to make so that we can provide more robust coverage for Nigerians. Situation that it's only a limited amount of coverage that is available to cancer patients in by the insurance provider. It's not acceptable to us, but we will be going into the future. All the changes we need to make so that those National Insurance Agency and the other state health insurance agency will be able to provide full care, not for cancer alone, for other chronic conditions. But we're starting well actually by this sector-wide approach where we're going to use to mobilize more funds to go into our National Health Insurance Agency. So we have a full bird's eye view of what we're going to do, and we're moving right into it with full speed.
Your emphasis on funds and, making money available is absolutely not lost on me, as of course we look at the current economic situation. We know our reality. It's coming down to the Naira and the Kobo for every individual, but even for the corporates as well. Pharmaceuticals exiting, every single person is feeling the pinch. Ordinary painkiller has gone up in price. Those increases from 300 to even 900% increases in the cost of medication. What are the short-term interventions that we can look forward to?
I like that short-term intervention, but beyond short-term intervention, we're approaching this with a holistic approach, short-term, medium, and long-term. And it's going, as you can see, if you've been following the news in the last few weeks, the President Bola Tinubu is very concerned about this high cost of pharmaceuticals and medical consumables. This is one thing that bothers him so much. Now, at our Federal Executive Council meeting, he made everybody, we spent a large number of hours talking about what are the solutions that we need to provide to Nigerians to reduce that high cost immediately. And he said he will sign the executive order to get those actions, the plans to start working immediately. So he's mandated us at the Ministry of Health and the Attorney General to come up with a set of plans that he will sign as executive orders. And as you know, executive orders are law. So once that gets signed, we would begin to see some reduction in the prices of pharmaceuticals and medical consumables. But beyond that, it's also mandated us to come with medium and long-term plan. Unfortunately, we're here where we are today because of inadequate planning in the past. You go to any other advanced democracy, pharmaceutical companies, both multinational and local, you import, but you can't just continue to import and import without domesticating your manufacturing. And that's what's happened in our country in the past several decades. Company came in, they continue to import and import. Decades after, they're still importing. And suddenly they found that we have the exchange rate has gone up. It's not that extremely lucrative for them to import. They bail out on us. But if they had domesticated their manufacturing in Nigeria, the prices of drugs would not have been so sensitive to the fluctuating exchange rate. That's what we're now determined to address, so that in a sustainable manner, we won't find ourselves in this current situation we find ourselves.
Short term, there are plans in place. What do those plans look like?
Oh, the plans are,
What goes into the executive order?
I don't want to preempt the president here. It's giving us assignment as people that work for him. So he would have, I know he's very, very concerned about this, and he's very passionate about healthcare. Not only healthcare alone, he's passionate about fixing this country, and he's working so hard, and the trajectory of our country is good. Things are getting better. I know things are hard, but it will get better. Now, I don't want to preempt the president, but we're working diligently, very quickly, and very hard to get this set of plans to his desk. And obviously, the president will review this with his team and then decide on the ones he's going to pick for immediate implementation.
All right. Okay, yes, and looking at the medium and long term, of course, I have heard the explanation with regards to, pharmaceuticals not abiding to the necessary regulations, the 5x5 principle. However, some pharmaceuticals say that they also struggled with being able to get the necessary raw materials to manufacture. There's so many narratives out there, of course, along with the difficult economic situation. All we want to know, and all Nigerians want to know, is how are all of these things going to be overcome so we can achieve true medical industrialization? All of this, the narratives are there, the various factors, we're well aware of it, but what is the actual plan?
Good. There's so many ways to skin a cat, and you can come with so many narratives depending on where you're looking at. But then, the fact of the matter is that we haven't done things the way it should have been done. The 5+5 is a policy issue by NAFDAC, but we need legislation to back us into the future so that domestication of our pharmaceutical manufacturing will be done. Now, into the future, what do we do? That's why we're committed. The environment, we're creating the enabling environment to let private sector thrive. That's what will get us out of this mess. In the immediate terms, obviously we're going to do some structural things that the president is working on, but you've talked about beyond the narratives, where do we go from here to prevent us from getting into this same problem? And that's where our unlocking, that's our third pillar in the Ministry of Health on how we intend, what we're doing to completely revitalize the healthcare sector in Nigeria to be sustainable into the future. That's where the unlocking of the value chain comes in. We're going to be mobilizing private sector fund for pharmaceutical industry to come in, manufacture, even local pharmaceutical industry, support them to start using APIs, active pharmaceutical ingredient, technology transfer from other international pharmaceutical companies. NAFDAC is working towards moving quickly to get to maturity level 4. All this, and also really looking inward into our raw material. We have it. A lot of the things that are used for drugs are starch, medical grade starch. We have it in abundance here. But there's some process that you have to go through. There's some regulatory process you have to go through to be able to source those here. But now we have the will. It's the will of the government that matters. When you have the will, once there's a will, there's a way. And that's what this government is offering to Nigeria. We have a president that is determined to turn things around for Nigeria. And that's what we're doing. The enabling environment is being created so that people, my pharmaceutical companies will now come. There won't be this, oh, I can't do it mentality. The environment is rife for it to be done.
Now, the will exists, but my question is it enough? The CBN governor, Yemi Cardoso, recently made revelations that about 11 billion US dollars have been spent by Nigerians on healthcare outside of Nigeria in the past decade. You couple that with the thousands of doctors and healthcare professionals who are leaving the nation in droves. The irony of this really for me is that this 11 billion that's being spent outside of Nigeria is actually often spent on Nigerian healthcare professionals who are working in the diaspora. So beyond the will and beyond, we have heard the president try to encourage doctors and healthcare professionals to come home. But is will enough?
Good. In fact, you've actually asked two big questions: medical tourism and the human resource crisis for health that we have now. I'll address them differently. The first one, let me just take the medical tourism, which was the first question. Yeah, it's $11 billion in a decade is a staggering amount of money. That comes to about $1.1 billion a year. If we're able to keep that, even half of that amount here, it will stimulate our economy. Now, what are we now doing to reduce that outward movement of foreign currency that we need from our system? We're improving our healthcare system. We're collaborating with the private sector. I'm here today at Marcella Road. This is one of the things Marcella Road is one of the health company, a hospital that we're supporting as a government. We're giving them encouragement, unnecessary support. Marcella Road itself has reduced the number of cancer patients going abroad to seek care. And as we do more of this, NSIA, I told you, is building 6 new cancer centers. They already built one. They've built some that are currently functioning. The Lut NSIA Center, people are actually coming from abroad to have care here because the cost of providing such care is much cheaper. So beyond urban, we're even getting people inbound money, which I would term as FDI, coming into the country now. But as we continue, the way to stop that outbound movement of funds from our country for medical tourism is to improve infrastructure in our healthcare system. And that's what we're aggressively doing in the public sector. We're building more infrastructure. We're equipping our hospital with more state-of-the-art equipment. And then we're also collaborating more with the private sector so that we can begin to coordinate, listen to them, support them. As you can see at the HFN conference yesterday, this Controller General of Customs was there. He was specifically invited to answer a lot of questions the private sector, the questions they have on import duties, on some codes that they use, on some tariff by the custom. And the Controller General of Customs was so magnanimous in addressing a lot of those questions and promised that he will follow up with the ones that needed action. That's the collaboration that's been missing before. But this government now is now pushing aggressively for that. So it's not beyond, not with only the customs, but everywhere. The Minister of Trade and we also collaborate in the healthcare ministry. We're collaborating more with the Ministry of Trade and Investment to see how we can align things, our policies, our programs into the future. And once we have that, our healthcare delivery system, it's on a path of rock-solid, sustainable growth, where anybody will come to Nigeria, both citizens, even foreigners alike, and will get comprehensive care that is comparable to whatever you get in any part of the world. That's about medical tourism. Now, let me talk about the human resource for health crisis. Obviously, we've put so much, so much has been done already in tackling this crisis. The big thing is we're increasing production. We are leveraging a big population. We're over 200 million people. We need to leverage that population. So what have we done quickly? We've doubled the number of enrollees into all our institutions, all medical specialty institutions. More people have been admitted now to study medicine, nursing, more so in nursing. Before we came in as a government, where the country was, as a total total capacity to enroll about 28,000. Today, we're enrolling about 64,000. Before the end of this year, we'll be enrolling over 120,000 nurses into our nursing schools across the country. We're doing the same thing for all other specialty pharmacy, medical laboratory sciences, and radiography. And beyond that as well, we've also opened up more slots for internship, housemanship, and we're also partnering with some of the states, with Lagos State, to build a novel program where Lagos State is setting up a new university called Lagos University of Earth Sciences. We're working with them. They will train about 1,500 students. They will admit about 1,500 students into medical school in the first year. Same, we're going to admit a high number of students as well into pharmacy school, dental school, and then the facilities are there. Once we're able to do this pilot very well, we would now replicate this across the other 35 states of the Federation, probably as well as the Federal Capital Territory. So suddenly, years from now, we'll have a large number of medical people in the entire medical specialty that we're training in our country. Of course, people will leave, but we're producing, we have a large volume. So some people will stay. But then, what do we now do to retain and even bring people back, people that have already gone? We're improving welfare. The president is working on improving welfare package for all staffs, including the healthcare sector staff. We're also building, as I told you, building our infrastructure, equipping the hospital better. That in itself, we're creating a new enabling environment for people to come and then have good place to work and enjoy why they went to school in the first place, why they wanted to work as a healthcare worker in the first place. So we're doing that, and then the third part of what we're going to be doing, you're going to be hearing more from us at the Ministry of Health, is what we call managed migration, where we can coordinate better with the other countries where citizens are going to work and to begin to do things in a more coordinated manner. So I don't have any doubt in the next few years, the crisis we have in the human resource, in our healthcare workforce would be a thing of the past.
Great. So it's not something you feel needs to be addressed with legislation to try and retain people?
No, you can't force people to stay. It's a free world. It's just, people, I was working abroad and back. Everybody should have that liberty to work where they want to work. You provide the environment, and that's what we're doing. And that's what is going to be sustainable into the future. Before
we round up, and I know earlier you made mention to customs and tariffs and dealing with the Controller General. And of course, we know one of the biggest issues is with NAFDAC and the importation of pharmaceuticals. The statistics say that about 50% of what comes in is quote unquote fake. You'll verify this for me, but those are the statistics that are out there. So in all of these efforts we're making, there's been a huge erosion of trust between the healthcare system and people wanting to put themselves, often it's considered, at the mercy of the healthcare system. How are we building this trust that has been eroded, especially when we look at the fact that the medication that most people have access to there's a 50% chance that it's adulterated in one form or another? How do we address that?
The number of this high level of counterfeit drug, no. We don't have 50% counterfeit drug in the country, no. We need to really start messaging our own country in positive context, and let not other people do the narrative for us in a negative way. I just met with the Director General of NAFDAC just a few days ago. We went through the data. The percentage of counterfeit drug in our country, it's about 10%. That's still high. That's unacceptably high to us as a government. The World Health Standard is about 1%, but 10% is still very high. But then, what are we doing? They have the track and trace program that NAFDAC is using to track all this counterfeit drug. And another important data, we have to look at data here, not just emotions or speculation. The Controller General of Customs has that data. He presented it at the conference yesterday. He said from their own internet data, a seizing less counterfeit drug in the country in our ports today. If they're seizing less, the number of forfeiture they're doing by the customs, the number of forfeiture that customs is doing, if it's less, that means there are less counterfeit drugs coming into our country. That means our surveillance and monitoring the country is working. And then we're able to, as we get these drugs, we're destroying them. But we're not where we are. I spoke to the DG of NAFDAC to continue to expand the technology we use to monitoring these, the technology we're using to monitor these counterfeit drugs. And again, government is doing its best, we'll regulate, we'll monitor, but then I need to talk to the bad actors who are importing this drug. Please stop this. You can make enough money importing or making right drugs. There's enough money to be made in this country. There's enough money to be made in this country. So please, you Nigerian out there that is engaging in importing counterfeit drug, please stop it. You're killing our people. And I'm sure your intention is not to kill our people. We would work as government. We're doing our own, using the full force of the law to regulate and to prosecute. But we still want Nigerians to play by the rule.
Very well said. Dr. Tunji Alausa, thank you so much for your time. Before you go, however, I'd like to clarify one thing. For the duration of your term, where will you be doing your health care? Where will you be doing your medicals?
I'll tell you. Thank you. No, I put my money where my mouth is. I will be doing my care in Nigeria. And I'll tell you, it's already started. One senior government official got sick just probably around, probably was in September. They were going to fly that person out. I said, no, we will treat that person here as a demonstration of this government commitment to say, we believe, what we say, we believe it. And I told everybody that this is on my own personal integrity. That official was treated here in Nigeria, did so well, got every care that he or she would have gotten abroad, right in Nigeria. That person is better today and is back at work.
Okay, so can we trust you to recruit the rest of your executive to also commit to this, because it would be a great gesture for Nigerians? Of
course, it's a great gesture, but healthcare is personal. But what we have to do as a government is to get people to trust the healthcare system, and that's what we're working at.
Okay, so we'll be keeping tabs on you and all your medical checkups. Hopefully not too many of them. Of course, we wish you good health throughout your term and beyond. Dr. Tunji Alausa, Minister of State for Health and Social Welfare, thank you so much for your time today.
Thank you for having me.